corporation has recorded over and above 2,700 positive cases, including 60 deaths in the past 1 week alone. And keeping in mind the increasing number of cases every day, the KDMC had assured to ramp up the health infrastructure, which is really crumbling right now. In the last 1 week, the KDMC had assured that they will add 1,100 oxygen beds, they will add 300 ICU beds, but on the ground level, we are not really looking at those assurances being met. In fact, not even a single bed has been added in the 2 government-run hospitals that the KDMC is really dependent on to treat COVID-19 patients. As far as the other private and COVID care centers are concerned, only about 48 ICU beds have been added as against 300 that was assured. Only about 186 oxygen beds have been added as against 1,100 that was assured. And that is why we are looking at a massive health crisis, because the corporation has already reported nearly 20,000 positive cases. And people are being turned away specifically from the private hospitals, government-run hospitals, as there are no beds being available. Second most important point, on the other hand, if we talk about these dedicated COVID health centers, there are about 2 that the KDMC plans to set up. And in fact, the setup is already ready. We are in one such dedicated COVID health center, which is called as the Pakitar Bhavan, which has a capacity of 200 oxygen beds. And as we can see that those are ready, set up. But it has not been put to use yet. The center has not started yet, is what we are being told. It will take at least 2 to 3 days for the center to begin, where they can accept COVID patients. And there are about these 10 ICU beds as well, which have been set up here. So this is a dedicated COVID health center where not only, symptomatic, mild, but even critical patients can be brought for treatment, considering these are the facilities that they have actually started on board. They are yet to start. So this is the massive health infrastructure crisis that we are talking about. The KDMC is dependent only on 3 dedicated private hospitals, which is full to its capacity. Only 2 government-run hospitals, which is again full to its capacity, and there are about other 20 plus private hospitals, which has a very limited infrastructure space. And that is why when we also spoke to people across, they say that how they have, how they have to wait at least for 2 to 3 days for their number to come. Critical patients are being denied in, care as far as ICU and oxygen is concerned. So this is something that we are looking at, is the need of an hour right now. But it looks like the KDMC has failed to increase the health infrastructure as assured. With video journalist Sachin Yeram, this is Ishasha reporting here from Dombivli for Mirror Now.